Hey, it's Dr. Murphy. So it's been a while since I've been able to speak with you all. I've been dealing with a respiratory infection these last few weeks, and unfortunately, I had to be admitted into the hospital. But I'm doing much better now, and I can actually talk and do a video. So today, I will be speaking with you about things to look out for when you're home dealing with a cold that lets you know it's time to go in and get more care. So I'll tell you how my symptoms played out and the signs that let me know that it was time to go in. In the beginning, I had a sore throat, and then the next day, I had the body aches, fever, chills, headache, and a little bit of dizziness. My heart rate would go fast whenever I had the fever, but once I would get the fever down, it would improve. So I was taking Tylenol and ibuprofen, and I was drinking a lot of fluids because I wasn't eating as much. But after doing that for about 3 to 4 days, I was feeling better. Now, after about day 5 or 6, I noticed my breathing. I was really struggling to take a good breath. And when I was going up and down the steps, it was kind of difficult. Like I would tire out easily. And then I started to have some wheezing. And so now we're about a week into it. And I knew with these red flag signs of trouble breathing, wheezing, not being able to go up and down the steps as easily as normal, those would be some red flags to let you know it's time to go in. So I did an urgent care visit, and pretty much they treated me like an acute bronchitis where the airways are inflamed or irritated from whatever upper respiratory infection I had. 90% of the time, this is something viral. But they did end up treating me with an antibiotic just based on different factors. They may or may not choose to do so. But they gave me an antibiotic, steroids, and breathing treatments, and this did help. So I was good for that week. And then we're going into almost 3 weeks now, and I started to get worse again. So that's a big red flag. If you're better, but then getting worse, especially when it's the breathing getting worse, you need to go back in. So I was working this day, and I remember specifically it was day 18 into my illness. And that morning, I was checking my vitals because I was keeping a close eye on it throughout this entire course. And my heart rate was a little bit faster. It was like 105 when it had been back down to the 80s. And so I was like, this is strange. So, short of breath, wheezing again. Now my heart rate is creeping up. And I had to work that day. So I was a bad patient and unfortunately worked my whole shift. You know, some of us in healthcare will do that, put our health on the back burner so that we can take care of our patients. I wasn't seeing patients in person. I was doing virtual videos, so I wasn't like exposing anyone to my illness. But I did work my full shift. And then after that, I went into urgent care. And by this point, my heart rate was worse. It was 120s, 130s, and they did a chest x-ray, which was good. But the provider was like, sorry, I can't send you home. I need you to go to the emergency room because you need blood work, CAT scan, etc. So I agreed and I went to emergency room. Now that was an adventure. I had to sit in the lobby for 10 hours because they were so full. Um, they even had patients in the hallway. It was that busy. And so when I got there immediately, they did an EKG to make sure I wasn't in like a dangerous rhythm or that I wasn't having a heart attack. And thankfully, that looked good. It was fast. My heart rate was fast, but my rhythm was normal. So they didn't have to like use a machine to cardiovert me or shock my heart back into rhythm. They didn't have to use an emergency medication to get my heart rate down quickly. Thankfully, none of that. I had the type of tachycardia or heart rate that you get better after you just treat whatever illness is going on. And so once I did get back and had the CAT scan and blood work, my white blood cell count was elevated and my CAT scan showed pneumonitis, which is inflammation in the lung tissue, the lower lungs. And so that explained why my heart rate was fast. That's just my body trying to compensate and help me get more blood flow so that I can keep up with the oxygen demand that I needed at the time. And so they decided to admit me to the hospital because I had already taken antibiotics and got worse. So they wanted to treat me with IV antibiotics at this point. And so there was two different antibiotics they gave me, and then I was on steroids, breathing treatments, and of course a heart monitor. And so after 2 days of the treatments, my heart rate finally did respond. They did give me fluids, but that didn't do anything because again, I wasn't dehydrated. This was all due to the infection. And so after the second day, heart rate improved. I was feeling a little better. So I went home to finish out my course. And once I finished my medicines, I still wasn't 100%, and that's typical for pneumonia or a lung infection. It can take weeks, even after you finish your medicine, to get back towards normal. So I'm doing much, much better now. I'm glad I'm able to talk to you all today because I could not literally do a video like this 2 or 3 weeks ago. And so I hope this is helpful to let you know some of the things to look out for if you're home dealing with a cold. So if you have shortness of breath, noisy breathing, um, feeling very weak, dizzy, your fever's not responding to over-the-counter medicines, if you feel better and then all of a sudden getting worse again, those are all red flags. If you have the ability to check your vital signs like I did, I had a blood pressure machine and I had a pulse oximeter, the device you put on your finger to check your oxygen. It has your heart rate on there as well. So if you have the ability to check your vital signs and see that they are not in normal range, that could be another clue that it's time to go get help. So keep those things in mind and do what you can to keep your risk of infection down, keeping your hands clean, sanitizing your countertops, your doorknobs, just keeping, the surfaces germ-free, keeping your distance when others are coughing and sneezing and things like that. All right. Thank you all.